Hi, everyone, and thanks for joining us. For those who don't know me, my name is Len Valletta. I'm the principal here at Albany Financial Group. I am joined by John Gigliello, Jim Sullivan, Steve Kennedy, who are all advisors with Albany Financial Group. And our guest of honor today is Lori Ann Harris from HMS Agency. And we're talking about a very important topic today. Lori's been a great resource for us now for a few years, talking to our clients about health insurance, and in particular, for a lot of them that are on Medicare, and how on a yearly basis, you've got to make choices as to which plan you want to go to and so forth. So open enrollment is coming up. And so we thought this would be the ideal time to cover this topic. So we want to make this conversational. And our hope is that the questions that we ask Lori Ann as she goes through her slides will be questions that you might be thinking yourselves. If not, if you have questions that we didn't ask her or she doesn't cover in the presentation, feel free to follow up with us or her directly, as we're going to give you her contact information and hope we get your questions answered. So without any further ado, Lori Ann, I'm going to let you take over and we're going to go to your slideshow, but go ahead.
Thank you. Welcome, everybody, and thank you for spending the time. I think the topic is timely, and we hope this educational presentation will highlight questions, concerns, or answer many of the things that you have. Generally, the overview of today's presentation is we're just going to talk about what is Medicare, how do you become eligible, the options that are available to you, some of the costs, if you need assistance, some of the dates, and as all insurance people have, are lots of acronyms we hope we help you with. So first and foremost, what is Medicare? Medicare is actually one of the largest insurance programs in the world, but today it covers over 63 million people. You'll hear it referred to as CMS, which is Centers for Medicare and Medicaid, which is part of the Department of Health and Human Services. There are many parts to Medicare. Parts A and B are original and began when Roosevelt put these in place. Part C is fairly new in the past 15 to 20 years. That is called a Medicare Advantage plan. And Part D is the prescription drug coverage, and we'll get into a lot of detail. Medicare eligibility. It initially starts when you're 65, but we'll talk about those of you who may not need to enroll. You will get lots of mail when you turn 65, and that's because the insurance carriers all know when your birthday is. And so they start sending you mail, and you're all nodding your heads because you know that's happening at least 3 months before your birthday. And we'll talk about if you have to do that. The Medicare Part A is premium free for most of you, and different qualifiers will help you decide whether you receive Medicare earlier than when you're 65. And you will be eligible for Parts A and B if you're under 65 for disability or end-stage renal disease.
So Lori, I have a question that comes up quite a bit from clients of ours, and they ask if they need to enroll in Medicare and they're still 65 and working, what are the rules regarding that?
Great question, John. If you work for a business that has less than 20 employees, you're required to enroll in Parts A and B. And if you don't, the insurance carrier that you have through your employer could alter your benefits, almost penalize you if you did not enroll correctly. If you work for a business with more than 20 employees, you're not getting any mail from Medicare asking you to join. And actually, even if you're working for a business that's less than 20, you have to actively pursue enrolling in Medicare A and B.
Okay, thank you.
I think this slide's very important, and I think it will be very helpful as you go through your own personal decisions and what do all these letters of the alphabet mean. So Part A covers your hospital benefits, and Part A you have been paying for through part of your FICA if you were working. So you find people will discuss that Part A is free. It isn't free because you've paid for it your whole life. Part B, this is the part that you will pay for, and it covers everything outside of the hospital except for your prescription drugs. Part C is more of a bundled health plan. It covers everything that Medicare requires on your hospital, your Part B out of hospital, but it also, for the most part, covers your prescription drugs.
Okay, so I do have a question. So clients get an increase in their Social Security check. So last year was a pretty good one. Looking at another pretty good one coming up in January here. But a lot of years, the Medicare Part B premium jumps up a lot and eats into their Social Security benefit. I thought I just saw an announcement that the Medicare Part B premium might be coming down actually in January.
Correct.
And so this could be a real good year for clients, meaning they're going to get a nice increase in their Social Security check and maybe actually a decrease in their Medicare Part B monthly premium. Is that correct?
Correct.
Okay.
So the premium is going from $170.10 down to $164.90. And to Len's point, that will be effective January 1st, 2023.
Okay, and so something we work with a lot of our clients, obviously, if their income is above certain levels, then their Medicare Part B premium can be higher as well.
Correct. Right. So
As well as D, right? Yeah.
good point. So
Yeah.
people are going to be hearing this news that their premium is going down. And then some of you, if your income is higher, and this is where all these guys come into play, you may still pay more because if your income is high, there is what they call IRMA, which you could pay more for Part B and Part D. But these are concerns that the gentleman in the room would be addressing with you.
Right. It's basically sometimes it's planning where you take your distributions from, et cetera. So we've been fortunate to be able to work with clients sometimes and get them to reduce their income strategically, which can cause them to pay lower Medicare premiums 2 years later.
Correct.
Good. Okay.
I think this page is very important, and this comes out of this Medicare New book. You may not be able to see this, but this is the 2023 book that those of you who actually are enrolled in Medicare Parts A and B receive. So this is the page out of that book, and I really like it. I call it a roadmap because it really, there's two sides of the street. There's the left side of the street that talks about when you participate with original Medicare, and it even highlights some pictures so you know Part A is hospital, Part B is everything outside the hospital. So on the right side of the page, there are people who go on either side, and they decide this every year once they're eligible for A and B. The right side, you would consider what they call a supplement plan or a Medigap. The other side of the street, of the road, is another decision you make. You decide to possibly take a Medicare Advantage plan. And for the most part, that's the mail all of you are getting. It's all these insurance companies want you to enroll in these types of plans that bundle your health care. And a licensed broker would be able to identify which is better for you. But I think the important part is understanding the terminology. A Medicare Advantage plan is not a Medicare supplement plan. A supplement plan picks up what Medicare doesn't cover, where an Advantage plan, it becomes your only health plan and the rules and regulations that go with that.
Lorraine, just wanted to clarify a couple of things. I think this is where some clients may get confused. A lot of times they might interchange Medigap and Medicare Advantage. So there's original Medicare, and you could add on Medigap to that to fill potential gaps or some of the gaps. Or you could go completely the different route and take a Medicare Advantage plan.
Absolutely. You're right. So people do interchange the word. So a supplement is also called a Medigap plan. And they, believe it or not, Medicare does have out-of-pocket costs, and that's where a supplement plan picks up, is those gaps in coverage.
And Lorianne, is there a rule of thumb that we can use to try to help clients with determining which option is best for them?
Great question, Jim. Yes. When we first addressed this, and I always bring out this slide, we talk about their needs, their health needs. We talk about, do they travel? Do we have to make sure that doctors and hospitals are in the area they're moving to? Do they have children in other parts of the country? They want to have freedom to move around. And then there are people who have a lot of skilled nursing care. A supplement plan is a much stronger benefit in that case. So we have to ask certain specific questions. And in terms of geographic concerns and their out-of-pocket costs. Sometimes we ask clients, what were your costs last year? How much did you pay in co-pays or out-of-pocket costs? That really gives us an indicator of where they may be in the future.
Thank you. And they can make changes each year depending on what's happening in their own financial life and health life.
Absolutely. There is, to Len's, and to your point, Jim, the open enrollment is starting October 15th. And there are other extenuating circumstances where people can enroll if they move away. We talk about maybe their child moved to the Carolinas and now they want to go. That's another time of year where they can make a change.
Understood. Thank you.
So Lori, the timeliness of decision-making is obviously very important here. Are folks penalized if they don't make the decision in a certain time frame?
They can be, John, if they were required to take Part A and Part B. They weren't working, or they work for a small business and they let it go. They would possibly have a 10% penalty and have a time frame. They would have to wait until an open general enrollment period applied for them to even get into Medicare. So you really want to know what the circumstances are, why they didn't, because there are a lot of extenuating circumstances that allow them not to enroll. But if they let all those go, they could likely have a penalty that follows you the rest of your life.
Okay.
On your Part B premium.
All right, I got one more question for this slide. So we talked about how currently the Medicare Part B premium is $170 a month per person if your income is below certain levels, and it's deducted from your Social Security check. What if I'm still working? I'm not collecting Social Security, I should say, and I'm paying the Medicare Part B premium. How do I pay that if I'm not paying it through my Social Security check?
Good question. You're going to be billed quarterly for that premium, and they're going to want the quarter to get clean. So if you were a September birthday, that's not a quarter. You may get 4 months initially, and then they'll get you on a quarterly. They will ask you if you want to do it out of your checking account, but most seem to stick to the quarterly.
Okay. All right. Good. Good.
So, Jim, you touched on this, talking about, how do we figure out the differences in the plans? And I won't go into a whole lot of detail, but I thought this slide was good to talk about how do I start this conversation between traditional Medicare or a Medicare Advantage plan. And, we talk about the coverages. We talk about sometimes additional benefits. With a Medicare Advantage plan, all these insurance companies want your business. So they want to give you hearing benefits and dental benefits and this and that, those shiny things. That may be the most important thing that you care about. You're super healthy. The provider network, John, you touched on that. How do we pick and choose where that is? If you want to be able to go very fluidly from one area to another, we have to talk about that. We may want Medicare because Medicare is a behemoth and most hospitals and many, many doctors take it. The cost of it, there are co-pays with Medicare Advantage plans, but there are also costs with traditional Medicare. And then in the out-of-pocket costs, Medicare Advantage plans have a cap. Traditional Medicare doesn't. You can continue to pay that. So this is a very important slide that gets the conversation started.
Rand, I heard you say that many doctors take it. Is it safe to assume then that there's some doctors or specialists that someone sees, a client of ours, that they may not accept Medicare nor Medicare Advantage?
Absolutely. As a government provided care insurance company, Medicare doesn't pay doctors well. I think we all know that. And so a lot of doctors reluctantly participate, but some dig their heels in and they'll say, I'm not going to participate. And if you're with original Medicare, that's a concern. And so that's a good question, and always refer back to your doctor to ask, what plans they participate with.
So folks, there's a lot of information on these slides. So we're going to give you all the ability to get a copy of these slides, if you will. Mary Beth here in the office can get them to you. I think at the end of the presentation, her email address is going to be there, but it's mflagler albanyfinancial.com. But like I say, it'll be at the end of the presentation. You'll see your email address. Just kind of small print there, if you will, but we wanted to get this slide up because last couple have a lot of great information, but it may be hard to see if you're looking on your laptop.
So we've been talking about Medicare Advantage plans, which are also called Part C. And there's different types, so let's just make it more complicated, right? Provide more things. So you'll see when you get mail from insurance companies, they talk about a PPO plan. That means that you can see doctors in the network, and the network doesn't have to be in our region. The network can be nationwide. But we talked about doctors, Steve mentioned, that don't participate with anything. A PPO plan would still allow you to be able to go to that provider. You would pay more, but you could still go. So it gives you much more, where you don't wake up in the middle of the night and go, oh my God, did I ask if my doctor participates? It gives you that plan B, so to speak, if you need that. The next one is a private fee for service, not very common in our region, but they are available. That would be something you would want to speak to a broker about, where that fits your needs. A special needs plan. There are people that have health chronic conditions, or they receive additional care from the government. That's what that's called. And an HMO, a health maintenance organization. That limits your network to just the area. So if we're speaking about a plan with CDPHB, if you were in an HMO Medicare Advantage plan, you have to see doctors in that healthcare network. You cannot decide to go to Mississippi and see a doctor for second opinion. Not going to be covered. Very important to understand these. This one, the 2023 benefits aren't available, but I think it's important, and I'm not going to go through the detail, but what does Medicare cover? You've paid for this your whole life. What is it? What does Part A cover? What does Part B cover? Especially if you're taking a supplement plan, you want to know what those are. So when we do know what the 2023 benefits are, we will I'll provide that to the team here, and they can send that out to you. Enrollment periods, John, I think you talked about this. When do you enroll? So people have lots of times when they first turn 65 and they have to sign up. They have 7 months. That's what we call the initial enrollment period. There's special periods. That's when you do work for a big company and you decide to retire. That's a time that allows you to get in when you want to, or you're moving out of the area. And when I mean out of the area, you could be moving from Albany to Warren County. That's a new area. And then there's the general open enrollment if you've missed all the others. So there's lots of opportunities to know when you need to. And a lot of people just need to let their advisor know when that is, so we can make sure you don't miss any important periods of time.
Lorianne, how is it handled when one spouse is 65 and eligible for Medicare, and then their spouse is younger than them? How's it handled?
Great question, and very common. So we have to take lots of things in place. So we have a situation where the person's turning 65, but that person may still be working for a large business. They don't have to do anything. If this person works for a small business with less than 20, obviously we need to get them on Medicare. The spouse who's younger would be eligible for COBRA, or the state has individual plans we can look at for them. If the spouse is the one working and they're 63, or they could be much younger, that older person stays on that spouse's plan as long as that younger person's working. The younger spouse could be the woman, and she decides to work to 70. Her husband, who's 80, stays on her plan as long as she is actively working.
Understood. Thank you.
But again, all these rules come into play with the size of the business and what they need to do. There's a lot when you work for a business your prescription benefits are different. When you are enrolling in a Medicare plan, the way the coverage, there's stages. We won't get into the detail, but I think this is a really helpful screen, and the out-of-pocket for the prescription plan changes every year. So when that's issued, we will also update this slide. But I thought it was important just so you have the stages and understand how you leap from one to the next. Prescription, additionally, there are people who still need help with the way the prescription plan works. So if you're a resident of New York, there is a plan called Epic. Please make sure you understand that. Again, our agency helps people at least know it's available and can assist you if you need that benefit. How to apply for Medicare. So this is interesting. During COVID, the last couple of years, the Social Security offices were closed. And I think they're still skimpy with their hours of operation. So many people actually go online and set up an account. And I believe it's the best way, because even when you're going through the process, you may not be enrolling in Medicare at the time, but you're setting up the portal. I have walked through with clients who were making sure that they were getting on parts A and B. There's a chat area. You can print off the chat screen. It's saved with you. So whatever that you ask them, they will keep that in mind, because it takes the government very long to enroll you. Don't wait until the last minute if you have to enroll in Medicare. Give yourself time. But I believe the online is the best. You can call, and I think some of the Social Security are open, but I would educate yourself in other ways of enrolling.
Lori, a question for those of us who tend to procrastinate. We turn age 65. Is Medicare going to call us, let us know, hey, it's time to sign up, phone call, or what happens then?
Absolutely not. The only people that will automatically be enrolled are people that are collecting Social Security, because the government knows that you're getting that and they want to pull that premium, which we know is going down next year. Everybody else, they know you may be working. They don't know the size of the business. They're looking to you to enroll. You have to take an active role, and when you feel that you need to begin this process.
Thank you.
Are there any scams that our clients should be looking out for around this period?
Absolutely. You will be overwhelmed with mail. You will get mail that looks like it's coming from Medicare, official notice. And if you actively call or send in a postcard, you have opened the floodgates for call centers to call you day and night. Be very, very careful who you will share your information with. You have to say it's okay for them to call. So if you're getting phone calls somewhere along the line, a Facebook like or a call that you took, be very, very careful, because the number of calls will continue along with all the commercials. Really be very diligent in saying, does Joan Namath or JJ Walker really know what is best for me? Go to your an advisor that you feel comfortable with to ask those questions.
Sure, thank you.
So what have HMS and the rest of the team learned? A lot of you younger people participate in health savings accounts. You are supposed to stop contributing to your HSA 6 months before you enroll in Part A. They don't like that you have other insurance available to you. So make sure you look at that. We talked about people that can get COBRA. If you are over 65 and you are going to get a COBRA letter because you're going to tell your employer you're leaving, you really cannot sign up for COBRA because you have an option for something else. And be very careful. There's the wording in your COBRA we'll highlight that, but if you want us to take a look at it, please look at that. Don't just sign up for COBRA. Sometimes employers will help with their Part B premium, find out about that, ask that question if it's important to you. And then, we've talked about people that do have to pay more. That's called IRMA. All the experts in the room will talk to you about the planning for that. So those are just some of the lessons we've learned.
Yeah, and it's interesting, and when we talk to our clients about IRMA situations based on your income for, let's say, 2022, that's what your Medicare premiums be based on 2024. So we've had situations where we've had a client retire and they get their Medicare premium and it's pretty high, even though they're no longer working. So there are exceptions. You can file for exceptions.
Definitely.
Right, Lorianne? Yeah.
Definitely. And that is and that is so important, Len, because that comes up a lot.
Could be a sale of a business, different things, right? Yeah.
Absolutely. Yeah. Always question it. And so, the Social Security offers aren't terrible. But again, back to that chat, you have proof that you asked it. I think that's great on that Medicare.gov portal that we talked about. So get it in writing, get who you talk to, make sure, you have to be your best advocate.
Anybody else got any other questions for Lorianne before we sign off here?
Nope, all set.
So, this is really a great topic, although maybe not the most exciting thing people want to talk about, but it's a pretty complex area. We brought in a real expert here who's been a tremendous resource, as I already said to us. So many things can happen that can cause you to want to look at this every single year. So much more than even car insurance, homeowners insurance, and so on. This is really one of those things that every year you might want to relook at this if you're relocating. God forbid your health status change, your family status change. So there's a number of reasons why that you should want to look at this on an annual basis. So we mentioned open enrollment's coming up. It's October 15th, goes through to December 7th. So rather than just say, I'm going to renew with the same exact plan that I had last year, feel free to give Lorianne a call, call our office. But we're going to just refer you to her anyway. So, but her contact information will be at the end of the presentation, or I should say on the slideshow. So don't hesitate to reach out. We really hope you enjoyed our conversation today. And Lorianne, we want to thank you for being, as I say, a great resource and all the information you brought to us.
Thank you. And you were great panelists. Great questions.
Thank you.